Welcome to Everyday Heroes on Shaw TV. I'm your host, Leanne Evans. Today we take a look at a foundation going beyond the basics of healthcare. Since 1996, the Medicine Hat and District Health Foundation has been raising money to support and enhance healthcare in our community. Dan Kammerer is the executive director of the Health Foundation and says since 1996, they have raised just over $10 million, and every dime of that has been invested locally to impact patient care and family experience.
Everything from patient and family lounges on each of the nursing wards here in the hospital to equipment for almost every area, from emergency equipment to the operating room, from dialysis to neonatal intensive care, and from peds and others to senior services. Really impacted every area of the hospital.
He says many people feel that the government should supply all needs for healthcare, and in reality, the government can't fund everything the community wishes to have locally.
And so the community's opportunity is to make that difference by, by becoming donors to the Health Foundation to impact maybe an area or a department that they care about and make that difference sooner rather than later. The Health Foundation is really the conduit. At the end of the day, it's about connecting donors with passions for a certain area with identified healthcare needs for a better hospital and a better community for all.
Without the help of volunteers, the Health Foundation wouldn't be able to operate. Michael Dolan is the chair of the foundation and has volunteered with them for 6.5 years. He shares why he donates his time to the Health Foundation.
For me personally, more generally speaking, the Medicine Hat's been very good to me. So I want to be good to it too. I feel a need and a desire to give back to the community. And I've been involved in various organizations and boards, all on a volunteer basis for that purpose. Specifically with respect to the Health Foundation, until you need a hospital, until you're using the hospital, it's sort of just there. You know it's there. And I've been very fortunate to have 3 children born in the hospital. And my first child, it was a tough birth for her, and she spent her first night in NATO intensive care. And when I was asked if I would consider the Health Foundation, the first thing I thought of was that. And I thought, that's great. If I can help out, do something little to make sure that other people get the best possible care in Medicine Hat, I'd really like to help out there. So that's basically the reason I joined the Health Foundation.
Michael says they focus on many areas of the hospital for improvements.
We buy lots of things with respect to children, with respect to infants. Everyone wants to make sure our kids are looked after, especially at the beginning of their life. And so we have bought lots of pieces of equipment, omni-beds. We have giraffes, which is a name. It's really wonderful to see these things in use. And again, I can go back to my own personal experience, and the equipment that is now available that we've purchased wasn't available again when my kids were born. And to see just how well used that is and how that helps children, and more importantly, helps those kids who are struggling right off the get-go, is really key. And it's key to us being proud of what we do. And then there's other things, more the soft purchases we make, and the purchase probably isn't the correct statement. If you walk through the hospital, you'll see family rooms throughout. And these rooms have comfortable couches, they have bookshelves with books and games, they have a TV, they have video or DVD players. It looks like somebody's playroom or somebody's living room. And that is indirectly for the patient, but more directly for the family members of that patient. And it makes everyone's stay at the hospital all that much better.
With some of the equipment purchases, the Health Foundation has even shortened wait times.
In some areas of the hospital, we've decreased waiting times by half, from 18 months to 9 months. That's huge, especially if you need it. Absolutely huge. So without the Health Foundation, you'd see the pieces of equipment available for diagnostic services, for treatment services not here. They'd either have to go to Calgary or Edmonton or even the United States, worst case scenario. They can get that here. And I can tell you that's a lot handier for the people who need the services and a lot less stress for them and their families.
The Health Foundation holds many events throughout the year to raise money, And Dan says he really sees the donors as their hero.
We are simply the go-between. We are simply the facilitator. We simply put together the donors with the things that can be done locally to enhance healthcare. And so the donors are the real heroes. We simply act as the mediator, the facilitator, and really put together the donors' wishes with identified needs. And at the end of the day, the impact is what we get to see. We're overwhelmed oftentimes when you can see what a donor has done and we've been able to put together, make a child smile, or impact. And we hear stories about the families and their stay in the hospital and how much better it was by some of the things that our donors were able to accomplish. That's really what we're doing at the end of the day, and the donors really make that happen. I think they're the heroes.
For more information about the Health Foundation, you can visit their website at www.inyourcommunity.ca. Thank you for watching this edition of Everyday Heroes. Stay tuned because after the break, we take a look at the In-Between Youth Shelter in Medicine Hat.
Oh, hi, I'm Harold. I live in Victoria, British Columbia, and basically we went green.
Things on the roof through like tubes, and then my guess is that the water flows through them and it gets heated.
So we upgraded our house with an air source heat pump, a solar hot water system, and added a lot of insulation.
The simplest way to tackle our current climate change issues are really to reduce our emissions, and the simple thing is to start in your own household.
I am green power!
Once detected, it can be managed. But left untreated, diabetes can cause blindness, lead to amputation. It can cause stroke. And of the 2 million Canadians who have it, many don't know it. But with early detection, people with diabetes can lead long, healthy lives. So see your doctor and get tested today.
Welcome back to Everyday Heroes. Now we take a look at a service that is providing care and support for homeless youth. Imagine being a teenager and having no place to go. For some youth in Medicine Hat, that is a reality. McMan In-Between Youth Shelter provides teens between the ages of 12 and 17 a safe place to go. Executive Director of McMan, Chris Christie, says many people are surprised to learn the number of homeless youth in our community.
They're a very invisible population. Many of them are couch surfing, finding alternate places to hang out or live for temporary periods of time. And this year our shelter served 26 youth that accessed the bed of the shelter, as well as our outreach worker worked with an additional 40 to prevent homelessness.
Brandy Taylor is the program supervisor and says the shelter is a safe environment.
We see a lot of youth who are coming in that don't have that in their own homes, and as much as we can help, that's what we would like to do. There's such a cry for this that we actually need a bigger one because we have so many youth, and just placements are few and far between. They're really struggling for youth, so we're kind of a saving grace in a sense for them.
The shelter has 6 beds, and 5 of those are allocated for youth with Children's Services status, and the other one is allocated for homeless youth in the community.
So we've had kids come to the door, and so we meet with them and get all the information and connect with their parents, just to make sure that the stories are they coincide, and if the parents have to give permission for the youth to stay here if they are under 16. And then if they're 16 and 17, we just call the parents out of consideration and let them know that the youth is here, but they can provide consent for themselves.
Brandy says this isn't just a place to stay for the youth, they also need to follow some rules. The staff will also teach the youth life skills to prepare them for the real world.
Whether that be getting a resume together, doing some role play on how to hand out resumes, go through an interview, cooking, laundry, cleaning. We oversee their chores. They don't clean our house. We help them and assist them in learning how to actually clean a toilet or a bathtub or sweep or mop or so we're basically here to prepare them for the outside world and what it actually looks like and help them in every way that we can with that.
Brandy feels she is making a difference in the youth's lives, even if they don't see it at the beginning.
It's not a job that you receive instant gratification or, kids don't want to be here. This isn't their first choice, obviously, to come here, but just being able to be part of that and doing your best to help them and role model for them and do your best just to make them feel safe and that they are supported and have an adult that they can trust.
The shelter also offers programs to prevent homelessness.
Most important thing from my perspective is homeless youth are the farm league for homeless adults. So the earlier we can intervene and help, kids should be in their home. If it's a safe place to be, how do we help them there? How do we help them stay there? The government and us, the community, shouldn't be raising children. So how do we need those services in order to prevent homelessness from occurring in the first place, or to get kids into the right kind of services that can help them lead a happy and successful life.
Lisa Fosselt is the shelter outreach worker and works with the parents along with the youth to prevent homelessness.
My first approach is always to try to do some mediation with the family so that we can have that youth return home, rebuild those relationships so that they don't get into a habit of couch surfing, and we don't want to normalize that behavior so that they become like the farm team for the homelessness, for adult homelessness. So the other role that I do one-on-one youth support. So that might be helping them get a job, going to mental health appointments, meeting with their counselors at school, helping them find a job, all sorts of different things that they need to maintain their housing. I also do parent support. So when we get into this gray area between about 15 years old and 18, where the parents feel like they're at a loss on how to parent or what strategies to use. So I'll do some parenting support and help the parents put consequences in place and just kind of support what they're already wanting to do.
If you would like to help out the In-Between Youth Shelter, they are always accepting donations.
Whether it's hygiene products, clothing, a lot of kids sometimes come in without winter gear, hygiene products, anything like that, so we do supply that for them. Towels, everything, I mean, like, we provide everything, so any little donation of any sort helps. We get a lot of people that even at Christmas donate baking and food, and there are churches that like to donate slippers and hats and whatnot, and everything is well accepted.
For more information about the In-Between McMan Youth Shelter, you can visit their website at www.mcman.ca. Thank you for watching this edition of Everyday Heroes. Tell us about your local hero by emailing us at everydayheroes@sjrb.ca. See you next time.
Is a big family. It's people who have amputations like me. My prosthetic limbs, the Warm-Ups gave me, helped me so much. I can run, I can horseback ride, I can swim. Your amputation doesn't hold you back. You can do whatever you want.
My kids said their mom drank while driving them to school. I worried so much I couldn't concentrate at work. At Al-Anon Family Groups, I found the help I needed. If someone's drinking bothers you, call 1-888-4-AL-ANON or visit alanonfamilygroups.org.